My name is Diane Hudson-Barr, and I'm the clinical nurse specialist in the Newborn Critical Care Center here at UNC Hospitals.
I'm Karen Wood, and I'm the medical director of the Newborn Critical Care Center.
Kangaroo Care began in the 1980s in Colombia, South America, and doctors were finding that babies were being born prematurely, and the parents, because they lived from distances away, would actually leave their babies behind the hospital, not come and get them and take them home. And so they started to recommend that the mothers kangaroo care their babies 24 hours a day. So the mothers would come in and actually hold their babies, and they found that the babies gained weight and were able to be discharged from the hospital and also became connected to their families so that their families didn't abandon them. Kangaroo Care provides sort of a simulation of being back in the womb by having them what we call contained, so their parents are holding them closed up against them so they feel like they're back in the womb. And one of the ways that babies are able to comfort themselves is to feel that containment. So it also decreases the stress that they're experiencing too. There's been some research that shows that mothers will produce more breast milk and they'll have better letdown, so it's easier for them to establish and maintain breastfeeding. Also, interestingly enough, that the babies start to regulate themselves based on whoever's chest they're up against. So they will start to breathe in response to mom or dad's breathing. So that if they tend to have apnea, instead they get that reminder, and so they don't have apnea when they're being held. They will regulate their heart rate based on their parent's heart rate. And their temperature is regulated by being with their parent. This is a surprising thing that I found out recently, which is that mothers, when their baby's temperature goes down, their breast temperature will actually warm up. And if the baby's temperature goes up, their breast temperature will warm down to help keep that baby's temperature within a normal range.
Additional benefits of kangaroo care for babies include decreased pain during procedures and faster recovery after painful procedures, regulation of blood glucose levels and reduction of hypoglycemia, reduced risk and number of hospital-acquired infections, accelerated brain maturation with increased cerebral oxygenation and sleep regulation, and increased initiation of breastfeeding.
One of the toughest things for parents when they have a baby in the neonatal intensive care unit is, unlike somebody who has a healthy newborn who gets to take them home in 2 or 3 days, is these parents have to leave their baby in the hospital. And it's very difficult for them to be here 24 hours a day, 7 days a week. Oftentimes they have other children and have other responsibilities, or have decided to go back to work so that when the baby comes home, they'll be able to be home with the baby just like a mother or father would take maternity or paternity leave. So when they're able to do kangaroo care, it gives them that opportunity to connect or to attach to their baby. And it's very important for those connections to happen, because ultimately they're only in our care temporarily in the nursery, and the job is for us is to send them home to their family. So it's beneficial from that perspective. The other neat thing about it is that it gives them the opportunity to see that there really are things that they can do, because parents oftentimes feel like we've taken their role of parents away from them because they aren't familiar with how to give IV medications, or how to suction an endotracheal tube, or how to care for a baby who has all kinds of tubes and wires attached to them. So here is a way that parents can do what parents do, and that is be able to hold their baby and become very connected to their baby. And it's very, very helpful to help us establish that connection for the family.
The benefit for kangaroo care for mothers and fathers is, number one, it facilitates bonding. Maybe even more so, the bonding process for fathers who wouldn't ordinarily have that bonding facilitated by breastfeeding.
Additional benefits of kangaroo care for mothers include a reduced incidence of postpartum depression, increased maternal confidence, and decreased pain perception and discomfort.
It provides caretaking for the infant from the family member or the caretaker that really was supposed to be the caretaker, and it frees those staff members in an intensive care unit to provide care to those babies who are unstable and cannot provide the care.
One of the things that we know is that when babies have the opportunity to kangaroo care is that it does affect their behavior down the road when they're no longer being kangaroo cared. So if parents are able to do that once a day for at least an hour at a time, that it really makes the babies calmer the rest of the time when they're not being kangaroo cared. And one of the things that happens, and again, this is a benefit for the baby as well, is when babies are agitated, they're wasting important calories that they need to grow on being agitated. And so they're less agitated, and then the nurses don't have to disturb them as much. And so, it's kind of a win-win in that they're able to get the care they need and the attention they need, but the nurses are also able to back off and give them the time they need to sleep and to grow, because that's how they're going to get out of here, is to gain weight, and that's how what they need to do to be able to go home. Every unit in the country has different limitations as to when they would allow somebody to start kangaroo caring, and that really is related to what are the concerns with the risks versus benefits of using kangaroo care. So for those babies who are really sick, who don't tolerate being touched at all, who are on so many medications that even moving them requires a significant adjustment in their medications, those babies probably aren't quite ready to be kangaroo cared. And the benefits they would gain would then be sort of eliminated by the fact that they were so stressed by having them moved that it wouldn't be a good decision. But we do try to individualize that so that each baby's time, they sort of give you the clue when it's time. It's not like there's a certain age or a certain number of days of being alive that it's the best time to do it. It's all about that baby, and even that day. Sometimes there's a time of the day that's better than another time of the day. So the baby gives you a lot of information about when is the best time to do it.
Some of the babies in the neonatal intensive care unit are on so many mechanical devices that it makes that impossible, or the baby is too unstable to even facilitate being moved from the bed into the caregiver's arms. Outside of that, there really aren't limitations. We sometimes limit the amount of time at the beginning to see how babies are going to transition with the different stimulation. But it's really the baby's physical state that determines whether they can kangaroo care or not.
What parents could do when they want to start kangarooing is to ask the nurse. We really have become much more supportive of kangaroo care across the country and in our unit specifically, so I think we do a little better job of it. But there are still some nurses that are a little uncomfortable with it, and so for parents to say, I know that we have an option to kangaroo care, I would like to kangaroo care.
I think that we're very proactive about encouraging parents to touch their babies, and positive touch, recognizing that premature babies tolerate really only one form of stimulation at a time. So we encourage them to touch them but don't talk to them, or talk to them but don't touch them, but not all of that stimulation all at once.
The last thing I'd want to mention about kangaroo care is that there are only a couple of things that the family is really the only one that can do it for the baby. And kangaroo care is one of those examples. The other example is providing breast milk for the baby. So this is something that nurses don't kangaroo the babies. We don't have volunteers that kangaroo the babies. So this is something that's really been encouraged to facilitate parents bonding with their child, or becoming attached to their child. So it's really important to realize that this is something that you can do. So you may feel frustrated that you're not able to feed the baby yet if you're the parent, or you may feel frustrated that you're not giving the bath, or you don't do the nursing care kinds of things because you're not a nurse. But here is something that you can do as a parent, and only you as a parent can do.
For additional resources about kangaroo care, you can refer to the March of Dimes website, the University of Michigan's Kangaroo Care Parent Guide, and the United States Institute for Kangaroo Care website.